We're going to be talking about the disease that America fears most. You might think it's cancer, but actually polls show Alzheimer's is the disease that all of us fear the most. And, well, with good reason, right? Nobody wants to think about living without the use of your mind. And sadly, that's what happens for so many people in a growing number. And it's a serious problem, one we have to face. The cost of caring for Alzheimer's is going to be huge to society and, of course, huge to every family, not only from a financial standpoint, but the emotional impact, the stress, and that's just a difficult challenge. So we're going to talk today with somebody for some tips and strategies on how you can make caring for an Alzheimer's patient better, easier, and more effective. She is Melanie Perry, Director of Memory Care Programs for American Senior Communities.
Good morning.
65 locations around the state you operate, so You're a busy person. Tell me about your role within that organization.
So my title is Director of Memory Care Support Services, and so basically what that entails is trying to make sure that we are keeping up with the research and innovations that are available to care for individuals living with diagnoses of Alzheimer's disease or related forms of dementia, and then making sure we bring those up-to-date, current quality of life techniques into our 65 Augustus Cottage memory care neighborhoods so that we can really ensure that if an individual is placed in a long-term care environment, that we can provide them with the best quality of life possible within our neighborhoods.
Most people who haven't been exposed to Alzheimer's associate it with memory loss, but it is so much more. Give me an idea of how an Alzheimer's person might think, what behavior challenges they have.
Well, and there's a saying out there about Alzheimer's disease and dementia that once you've met one person with Alzheimer's disease, you've met one person. And so basically that alludes to the very idiosyncratic, very individualized experience that dementia is. So we know that there are some trending experiences that people will have. Most notably, the consistent symptom that individuals will have will be that declination in short-term memory retention. So we lose our short-term memories first and foremost, generally as part of most dementia journeys. With the exception of one called the frontal temporal lobe degeneration, but we can save those for another day perhaps.
Okay.
But for the most part, short-term memory loss, we know that individuals will develop word-finding difficulties, maybe self-care challenges in the beginning of their journey. But then as they progress through a journey, those symptoms will become much more severe and much more varied. But it could lead to some type of what we call behavioral expression, and maybe that's where we have a change in our personality. So perhaps we have been somebody who's been kind of calm, cool, and collected all of our lives. Well, in the midst of our dementia, basically that filtration system that was helping us to take a deep breath and stop and think before we react may go away. So now all of a sudden we're acting and reacting. And so it may make us appear as if we've changed our personality when actually what may be happening is just that filtration system is breaking down.
Filters are gone. There's no filter.
Absolutely.
You're saying it just comes to mind and it comes out.
It does come out.
And that's anger, that's frustration, that's all of those things that are so difficult to deal with because you have somebody who no longer is in rational command of the facts.
Exactly. And so we may use words that we've never used before to express ourselves, and so that could be very shocking to family members. We may actually sometimes use our fists to express that something's wrong with our world. So sometimes we do see that people have even an increase in what we call aggressive behavioral expressions. So it can be quite varied. And then along with that are different physiological and medical conditions that can develop where our brain and our body are just not talking anymore. And so we may be more likely to have falls. We may develop what we call a visuospatial disruption where we're not seeing the world quite as accurately as we once did. So maybe we're walking into corners, we're having trouble navigating patterns on floors. So just a myriad of potential challenges that can accompany a dementia journey.
It is a cruel
it's
disease.
Awful.
Yeah.
It's awful.
And if it's touching your family and you have a question, I have somebody here who knows quite a bit about Alzheimer's and caring for patients. That's what she specializes in. So if you'd like to be part of the conversation, we invite your call at 447-1190, 800-333-1190, or you can always text us at 46862. Just start your message with Healthline or HealthCALL. Just put health in there somewhere. It doesn't really matter. Well, it'll get to us, and we'll get your question in front of Melanie for you. Men and women express Alzheimer's differently. Tell me more about that.
So we tend to find that, first and foremost, women have a greater proclivity or potential or vulnerability to develop Alzheimer's or dementia. So it is more likely that women will develop most forms of dementia other than men. But then when they express it, very often it kind of can be a little bit more associated to the testosterone experience, in that very often when men are having challenges or experiences with their dementia, we may see some more of that physical expression that we were talking about, whereas with females, it may be more likely to be other expressions or other challenges along with their dementia. So again, it's that role of estrogen versus testosterone maintains even in this type of a situation as well.
Well, that leads me to a very difficult conversation that some people have to have, and that is inappropriate behaviors with dementia patients. And, humans are sexual beings, and that doesn't go away just because you're advanced in years or that your processes and your mental processes are failing. And in fact, because there are no barriers anymore, that can get very challenging. What are some things you can do about that?
Well, we know that that can be a challenge, very much so, that those sexual expressions and expressions of intimacy will become a part of a person's experience. And so there are a few things that can be done, is just simple redirection of the individual, not by trying to scold them or demean them if they say something that's offensive, or if they're making a suggestion or suggesting an act, but rather what we can do is to remind them of the person that we know that they have been. And so we could say something like, Lee, I know that you have always been a gentleman, and I know you would never want to offend a lady. So perhaps we could rephrase that, or we could talk about something else right now, rather than saying, Lee, that's inappropriate, I don't think you should say that. But if we can remind the person of who they have been and still uplift them in the midst of reminding them and redirecting, that can be a very helpful process. In extreme cases, sometimes there can be medications that can be provided that will quell some of those sexual urges and sexual thoughts. And then finally, if it is an individual who's going into a long-term care placement, sometimes finding a gender-specific placement situation can be helpful. So for instance, our local community at Canterbury Nursing and Rehab, we actually do have a male neighborhood and a female neighborhood within that community. And so sometimes separating by gender can also help with that situation.
Yeah, and that's important for an unusual reason that I learned from some work with you, and that is jealousy becomes a huge challenge. So you may not be my spouse, but I now adopt you as my spouse, and now I get very jealous and combative when somebody else wants your attention.
Yes, and that is also one of the reasons why we do receive individuals into these gender-specific neighborhoods. It's not at all uncommon that they have been in an integrated memory care neighborhood, and as you said, my perception is this person now is my spouse, and all that we need to remember is that for somebody who's living with Alzheimer's or dementia, that their perception is their reality as much as our perception is our version of reality. So we're not going to talk them out of it. We're not going to say that person's not your spouse. Here's a picture of your true spouse. It's not going to matter. If that person perceives that, that's their reality. And so moving to this gender-specific situation can be very helpful in that regard and cut down on that jealousy.
I'm sorry. No, please.
I'm sorry, but what a tough thing for the true spouse to experience when they know that their loved one is seeing somebody else as their spouse.
Oh, yeah. That's got to be heartbreaking.
Indeed.
So let's walk down that path of coping with that altered reality in which they now live. That's got to be so hard for a loved one to see them now living in a world that is nowhere near reality, and you can't really drag them back.
Right.
So is it okay to encourage that if that helps them, if that calms them? Can I just, yes, you were a librarian, or whatever that might be?
Yes, and in fact it is. And some people, this is probably one of the toughest things that a caregiver will have to come to terms with in accepting a loved one's journey. So we know that 20 years ago, even in the field of dementia care, 25 years ago, we were using something called reality orientation. And the philosophy was, you must keep them grounded in the current reality or they'll slip away from us that much faster. Well, we didn't find that was the case, and what we were doing instead was creating more negative emotions on the part of the person with dementia by confronting them with this reality that they no longer perceive. Oh, you're a liar. You don't know what you're talking about. Or we would upset somebody or restart mourning processes if they didn't remember that a spouse was gone, and we remind them of that fact. We would start a mourning process again and again and again for that individual. And I know I don't want to be a part of creating that type of a negative response in individuals. So fortunately, there was a lady that came along. Her name is Naomi File, who developed something called validation therapy. And with validation, we do just what you were referring to, and that is we enter that person's reality. We figure out where they are in their perception of the world, and we respond to that perception rather than trying to talk them out of it. And if we do that and join them there, we find that the caregiver tends to be I should say there are fewer arguments that very often occur between a caregiver and a loved one. There's less stress, less anxiety, and we're just going through this journey together, and we're working through that person's perception.
I want to shift focus away from the patient, the loved one, and now more toward the caregiver, because that is where most of us are going to feel the burden.
Yes.
Caregiver burnout is huge. What are some strategies we can use there?
So you're right, caregiver burnout is huge, and if we find that we have an individual caregiver trying to care for a loved one all by themselves without availing themselves of resources, that the caregiver in a surprising percentage of time can actually precede the person with dementia in death, because they forego their own health care.
I'm 82 and I have to take care of my 87-year-old husband, or vice versa, my wife, and my health can be challenged, and the pressure of that just drives me deeper and deeper into the hole.
Exactly.
It's huge.
It is huge. So what we really advise to caregivers, and we share this tidbit, is if a caregiver can learn to say the word "so what" in the care of their loved one, and I'm not saying so what that they have dementia, because there's nothing that's not important about that. However, the way we approach their care is so important. So if we understand, if we are caring for somebody, the importance is the safety and well-being and quality of life of both the caregiver and the person with dementia, which means we may have to lower our standards a little bit of our expectations of ourselves and of our loved ones. So maybe the house is not going to be perfectly kept as it once was. Maybe we're not going to put a 4-course meal on the table 3 times a day. And maybe my loved one is not going to look as impeccably dressed or as well coiffed or, as well make-upped as they once did. So instead, if we learn to say, so what? The house is okay. It's not perfect. The baseboards are a little dusty, but so what? It's all right. We're getting along. We're having a good day today. Maybe we didn't have a 4-course meal, but we got some nutrition into us, and we're healthy, and we're feeling good about that. So what? We didn't get the full meal on the table. My loved one mixed a plaid and polka dot outfit together today. If we're not going out in public, so what? Is it okay? Is it so important that we're matching clothes today if we're not going out into public? So if we can learn to lessen our expectations in these situations of ourselves and our loved ones just a little bit and give ourselves a break, then we find that it can also lessen the caregiving burden significantly.
You use the phrase "on their journey" often, and I think that's important for caregivers to realize and family members to realize as well. Is the person I know today is not going to be the person I know next week, the week after.
Truly.
So we have to be more fluid in our expectations and our ability to cope. That's stressful in and of itself.
It is. And so, again, that learning to say, so what is important, but then also just understanding that change is going to happen. And so every day we just need to kind of get up and figure out where is our loved one today. So there's a big fancy term called retrogenesis that's associated with Alzheimer's and related forms of dementia. Basically what happens is our loved one is going back into their past, into their history. So our job is to figure out where are they today? Where do they think they are? What age do they think they are? What time of life do they think that they are in? And then once we figure that out, then we join them there on this particular day. Tomorrow might be different. Tomorrow they might think that they're in an earlier phase of their life. We just need to go on the ride with them, go on that journey with them, join them there, and just stick with them through this whole process.
In a moment of agitation, is it appropriate to try and take someone to that happy place? I mean, what might be a strategy for me to divert attention away from whatever the irritant is and get them into a happy place?
Sure. So I can tell you within our Augustus cottages, our memory care neighborhoods within American senior communities, one of the most common techniques that we use to help get our residents to that happy place, if they're in a less than happy place, is a process known as reminiscence. And so, as we all are aware, that term means we reminisce about happy times in our lives. And so if we can take that person back to a time that they do remember, a time where they still do have pleasant memories, very often they can remember those times very, very keenly, very accurately. They could tell you the color of the paint that was on the wall, the person they were with, the conversation that they had. And so if they can go back and experience that, and we can help them get to that place through photo albums or just recalling some great times and say, Mom, do you remember when we went camping and it rained all night and we all got wet, but it was just one of our best camping memories ever. Do you remember that? We all laughed about the next day. Taking them back with those wonderful stories and prompting them can really return that person to a happier place.
So I'm thinking that if I have to be conscious and have almost a notebook of these are things that Mom likes to talk about and think about, and those are your go-tos. So I guess it's not wrong to manipulate their lack of awareness if it's to their benefit.
Indeed. And so that's another thing that some caregivers have difficulty with. So they're saying, so you're telling me I have to lie to my loved one? And so we're not asking you to lie to them, but as much, again, as enter their reality, honor their perception at any given time. And so I love that idea of having a notebook filled with great things to talk about. Because again, if we have a loved one who's in the midst of a moment of upset, sometimes our rational thought and our emotions will get wrapped up into that person's experience. So if we have an objective source that we can go to, a reference that we can use, I love that idea of having that, or maybe a box of items that we can go to, because again, we can prompt conversation, but for somebody with Alzheimer's or dementia, it's also very helpful to have some additional visual cues as well. Mm-hmm. So maybe we have a box that relates to happy times, of pictures, of mementos, of souvenirs from places that we've been, and bring those out, and the person can look at it, touch it, and it reinforces that perspective as well.
Oh, a happy time memory box. That's a great idea. I like that a lot. Okay, 2 areas I want to hit before time escapes us here, so we need to do it quickly.
Okay.
Holidays are coming. Give me 2 thoughts on managing the stress of holidays.
Sure.
For people with dementia.
So we want to make sure that we maintain consistency on the part of the person's life, because consistency and predictability adds comfort to the life of somebody with Alzheimer's or dementia. So let's not try and change up their routine too much during the holidays. We also need to remember that there's greater potential for overstimulation, meaning, oh my goodness, all of these wonderful colors, all of these wonderful lights, all of these wonderful people coming into town, so many great things to eat. For somebody with dementia, it can become just a little bit much. And so be very aware of our loved one's response, and if they're starting to become too upset, take them out of that situation. If people are coming into our home, maybe have what we might call a respite room within the home, so that a quiet space that person can go to, have some things that they enjoy, maybe some music, maybe some favorite things to look at and to interact with, and they can just kind of calm themselves again in this respite room within their own home.
I kind of like that thought for me, actually.
It sounds pretty nice.
A respite room with all the people in the house.
I think we call that a man cave.
Yeah, I think you know things. It's going to be obvious when the time has come that you need to find a different place for that person to live with special needs. So let's talk a little bit about how do I pick a memory care center, because services are all over the board.
They are all over the board. So first and foremost, you want to figure out what care venues are available in the area that meet your loved one at what point they are in their journey. So there are care venues that are for people earlier in their journey, and then the care venues that will take people to the very end of their lifespan within their journey. So finding out where they are. Secondly, try and find a community that matches the lifestyle of your loved one. So look for those. If your loved one likes to be active, really look for those communities that have an active, meaningful activity calendar. And the only way you can do that is by going in and visiting these communities. So pick some that you think sound like they would be a good fit for your loved one. Do a little bit of research through the Alzheimer's Association, through other area on agency resources, and find out. Then go and visit, and you will determine through the feel of the location if it might be a good fit for your loved one. So look for things, active programming. You want to look at how the place looks and feels. Does it feel more like an institution? Does it feel more like home? Look at how the team members are interacting with the residents, how it feels. Are team members smiling to each other? Are they interacting and hugging the residents for whom they're caring? And really just get a good feel. And so within our Augustus cottages in the area too, we encourage people to come and visit those if they are considering placement, and see if maybe we might be a good fit for their loved ones as well.
So much more to talk about. Time has escaped us. Thank you so much, Melanie Perry. And if you are interested, American Senior Communities has 65 memory care centers all over Indiana. You can find them online at asccare.com. We hope that you'll join us next Saturday morning right here on WOWO for another edition of the Health Call Live Radio Hour. And look for us on Facebook and also on the web at healthcall.live for edited versions of This Time with Melanie and all our other guests as well. We'll see you next week.